My respected teachers, dignified faculties, and dear fellows, good morning. This is Dr. Sayeedur Rahman from NSCVT. Welcome you all to my presentation. This is the topic of my paper, that is molecular analysis of CYP2C19 alleles and clopidogrel resistance among Bangladeshi patients with acute coronary syndrome. Antiplatelet therapy is a cornerstone in the management of acute coronary syndrome and the prevention of stent thrombosis after PCI. After aspirin, clopidogrel is the widely used antiplatelet drug in our country. Many studies showed that clopidogrel resistance is the emerging problem for managing ACS patient and after coronary intervention. Currently available laboratory testing for clopidogrel resistance are platelet function test and genotyping for CYP2C19 variants. Drug levels and antiplatelet effects of clopidogrel differ depending on the genotype of CYP2C19 enzyme. Based on CYP2C19 genotype, individuals are categorized in different phenotype: ultra-rapid metabolizer, extensive metabolizer, intermediate metabolizer, and poor metabolizer. A study by Shantanu Guha et al. Has shown about 90% patients are clopidogrel resistant in India. According to Hawk et al., about 46.7% and Munwar et al., about 56.6% Bangladeshi population are clopidogrel resistant, which is higher when compared with other study. But exact data about clopidogrel resistance of Bangladeshi population is still unknown. So this study was conducted to determine the prevalence of clopidogrel resistance by a CYP2C19 assay among the Bangladeshi patients with acute coronary syndrome. This observational study was done Department of Cardiology, NSCVT, from July 2019 to June 2020. Total 200 patients with acute coronary syndrome are enrolled to see the prevalence of clopidogrel resistance. Patient was diagnosed with unstable angina, non-ST elevation MI, ST elevation MI as per clinical presentation, ECG changes, and cardiac marker. Blood sample was collected and sent for biochemical investigation as clopidogrel pharmacogenetic. DNA extraction from whole blood was done using DNA extraction kit. Quantification of DNA was done using Quantas fluorometer. PCR was done using applied biosystem 2720, then final analysis done. Now result. The mean age of the study population was 52 years and the study showed male predominance. Among the study population, 49% was ST-MI patient, 31% was non-ST-MI patient, and 20% was unstable angina patient. Female patient and smoker patient had higher incidence of clopidogrel resistance. This bar diagram showing frequency of CYP2C19 alleles in ACS patient and dominant CYP2C19 alleles was 1/2, that was 52% of all study population. This pie chart showing frequency of CYP2C19 phenotype in ACS patient. Intermediate metabolizer was 55%, extensive metabolizer was 33%, ultra-rapid metabolizer was 11%, and poor metabolizer was only 1%. This table showing frequency of clopidogrel resistance in unstable angina, non-ST-MI, and ST-MI patient. The treatment expense for ACS and PCS is still too high for our people. Using newer antiplatelet drug add more expense to the treatment cost, resulting in premature discontinuation of DAPT. Ultimately end up with more adverse cardiovascular event and stent thrombosis. In this study, we found 56% study population has clopidogrel resistance. Since we found that 55% of our population is intermediate metabolizer, so we can overcome this resistance by increasing the dose of the clopidogrel from 75 to 150 milligram. Current guidelines do not advise routine platelet function testing to identify the clopidogrel resistance. But it is good to do a clopidogrel genotyping of a patient with ACS, especially high-risk patient who will undergo PCI. We also suggest using double dose of clopidogrel when clopidogrel resistance is not possible to evaluate. Though we have alternative antiplatelet drugs like prasugrel and ticagrelor, but increased bleeding risk, increased treatment expense, as well as 2 times daily dosing of ticagrelor make this antiplatelet less convenient for many patients. We also had some limitation. This was a single center study. Study population was small. Only genotyping was done, but other platelet function tests were not used. Thank you. Thank you for your patient hearing.